Hi, it's Jason Blake, and I'm the Medicare Geek. I thought today we would talk about the pros and cons of Medicare Advantage plans. If you've already done AHIP, which you should have by now, you know what a Medicare plan is, so I'm not going to go into a lot of detail about that. There's some interesting history on the web if you want to look into that, but this is for the consumer. What are the pros and cons? Um, all plans have an out-of-pocket maximum, sometimes in-network only for HMOs or in and out of network for PPOs. Um, Original Medicare, there isn't officially an out-of-pocket maximum on a calendar year. You do have some copays for different services, though, where you can get certain Medicare supplements that can limit you to very little or no copays. Monthly premiums, Medicare Advantage plans, many go from $0 to $50 a month, very affordable, where a Medicare supplement may start at around $100. Um, they are difficult to compare, both because they're not always exactly alike and because they're different in different areas. That's a plus for you as an agent because you're the one to be the translating to help people translate those different things. Most Medicare Advantage plans are going to include Part D drug coverage, um, so you're not going to have to pay for a separate drug plan. Very few companies have nationwide coverage. Usually, when you travel, you're either, if you're on an HMO, you only have emergency or urgent care. Um, on a PPO, you can see out of network providers in other states, but you may have a higher out of network copay. There are a couple of companies that will have in network provider nationwide, but that is a consideration, just like with your health insurance when you worked. Plans can include dental, hearing, eyewear coverage. Um, Over here, most HMO plans can require a referral to see a specialist, and you can only see in-network doctors. Let me see what else we got here. Um, there can be gym memberships, silver sneakers, free gym membership on Medicare Advantage plans. Um, they can change benefits each year, so you have to look every year at your annual notice of change to see how much the plans change. You can always switch to another Medicare Advantage plan during open enrollment. I always tell people you're dating, you're not marrying your plan because you can change at least once a year. And then after your first year in a Medicare Advantage plan, it's pretty hard to switch to a Medigap plan. There are ways to do it. They're a little tricky, but once you kind of go the Medicare Advantage route, usually, unless you have a second home or you're moving or something like that, you're kind of going to be in Medicare Advantage for your life. With all that said, when people dog on Medicare Advantage plans and they just want to go with Medicare supplements because it's more expensive, what I will say to them is, well, what's your long-term care insurance costs? And if they go blank when I say that, it tells me they don't really have a plan for long-term care insurance. At least medical costs, except for maybe some prescription costs, are mostly managed. Either way you go with Medicare, original Medicare, or Medicare Advantage, long-term care costs are really the costs where people go bankrupt every year in America. From a medical cost point of view, once you're over the Medicare finish line, a lot of things become affordable, with the exception certain drugs are out of control right now. So I hope this helps. I hope it gives you some balanced ideas about the pros and cons of Medicare Advantage plans. If you have strong plans in your market and they have adequate access to a broad range of providers, for most people, Medicare Advantage is going to be more affordable. Hope this helps and go out there and help somebody else. Have a great day.